Hepatitis C is a global public health problem. The WHO estimates that between 130 and 150 million persons have chronic hepatitis C, which means lifelong infection that can lead to cancer or cirrhosis. And we estimate that between 350,000 and 500,000 persons die each year from hepatitis C-related diseases. The problem is around the world, but some regions are more affected. Africa and Asia have higher rates than other parts of the world. And in particular, Egypt is a country very affected by it, where 10% of the population has chronic hepatitis C infection. There's quite a variation in the epidemiology. In many countries where the healthcare system doesn't practice good infection prevention and control, most people get infected in the healthcare system through injections, through the reuse of needles and syringes, or other invasive medical procedures. In Europe and in North America, most of the infections are among persons who inject drugs, who share injection equipment. So we have a very different epidemiology. In some countries, it's a concentrated epidemic among primarily injecting drug users. And in other countries, it's a problem throughout the entire population. Hepatitis C can be treated and it can be cured. And the medicines are getting better, safer, and more effective. But there's a lot of other barriers that individuals have to overcome to get treated. And the first is that most people are not even aware that they have the infection. There aren't enough opportunities for persons to get tested for hepatitis C. Healthcare workers don't know to counsel patients to get tested. And many countries lack national testing policies to guide who should be tested. There aren't enough laboratories, as we know. Currently, to treat people, you have to diagnose them first, then confirm them with a second test, and then do genotyping and other sophisticated tests. So all that laboratory capacity is missing or is inadequate in many of the countries that we're focusing on, the low and middle income countries. So a lot of things have to be put in place before treatment is really going to scale up in any significant way. So in the area of treatment, at the EASL conference, we launched our hepatitis C guidelines, which are the first treatment guidelines issued by the World Health Organization on hepatitis. The fact that they're issued by the World Health Organization gives them an official nature, which countries look to WHO guidance as they develop their national policies. So we hope that these guidelines with its recommendations will move countries forward as they think about how to organize their hepatitis treatment plans. Second, the guidelines are take a public health approach, and that's why we were keen to have guidelines throughout the continuum of care, recommendations on screening, care, in addition to treatment. The guidelines are focused on low and middle income countries primarily, and so some of the recommendations took feasibility and the cost of the test into consideration and into our recommendations. In Europe, persons who inject drugs are a particular concern when it comes to hepatitis C. They are the group that has the highest rates of hepatitis C. In fact, globally, 2/3 of all injecting drug users are infected with hepatitis C. So we need special measures to reach these individuals. They're often refused treatment because physicians feel that they fear that they won't take their medicines or that they won't respond well. But we know that's not the case, that the persons who inject drugs do well with these drugs, as well as those who don't inject drugs. So special measures are needed to outreach measures to identify these individuals, provide treatment services, and link them with prevention services to make sure that persons with hep C don't transmit to others and they don't themselves get reinfected. We know that the drugs are expensive, and the other things, the testing and healthcare worker training, all those things will require investments. But a number of studies have been done to show that it's more cost effective to treat now than it is to wait for persons to develop cancer and cirrhosis and pay the much higher costs for liver transplantation and cancer care. ILC 2014 continues to show the dramatic improvements in the treatments and the combinations of drugs that result in almost 100% cure rates. From our perspective at the World Health Organization, we're keen to identify the treatments that are going to be the simplest to use and that will require the least amount of testing and that are the least expensive, so that we can really take the science from EASL and apply it in countries where we want to see more people getting treatment.